Well, I started recording just right now. Again, today is week 5 of the class in ASA College. This is the class Law and Ethic for healthcare professionals for the spring 2021. And we have a special guest today that is going to talk to us about a topic that surfaced in our class, that is the nurses' unions and everything about nurses' union. And we have a specialist here that have worked a lot in that field. That is New York State Senator Marisol Alcantara, Area Director of Westchester County and Hudson Valley, New York State Nurse Association. Thank you, Marisol, for coming. And if you can give a brief introduction about yourself, and also we are expecting to know to learn about the Nurse Association and the Nurses Union.
Okay, well, thank you for inviting me, and thank you everyone for allowing me to come into your classroom. I'm a trade unionist by profession. Prior to working for the New York State Nurses Association, I worked for SCIU Local 32BJ. So the New York State Nurses Association, our main office is right next to your college on 34th Street. We are on 131 West 34th Street, right next to you guys. We represent 42,000 registered nurses all across New York State. Not only nurses, we have midwives, we have nurse practitioners, and everything in between. We represent RN at some of the major hospitals in the city, such as we represent all the nurses at all the H&H facilities. Those are all the public hospitals: Bellevue, Lincoln, Harlem, Metropolitan, North Central Bronx, Jacoby. We also do most of the private hospitals in the state of New York. We have Columbia Presbyterian, Montefiore Medical Center, Einstein, Westchester Medical Center, all the way to Erie County. We have nurses in Albany, Buffalo, all the area, and we represent them. And we make sure that not only do we represent the nurses, but we also make sure that the delivery of care in poor communities is adequate. Like, one of the things that we've been fighting a lot about in Albany is that there's a nurse to patient ratio in each hospital. I'm sure you guys probably have seen in the news everything that has happened with the governor and the nursing home. We were one of the first organizations that brought that issue to life. Talking about, like that COVID patients should not have been sent to nursing homes, and things like that. I'm going to stop here because I can talk a lot. If you have any questions for me, I'd be more than happy to answer whatever questions you have.
I'm going to start with the questions, then my students are going to follow. Marisol, again, thank you so much for taking from your time. I know you're a very busy person. And my first question will be, again, what's the name of the organization that you work for, and what's the function of this organization?
It's called the New York State Nurses Association. I can put it in the chat. Short, they call it NYSNA, NYSNA, and we are a labor union that represent nurses in all the major hospitals in New York City.
Okay, and what are the main concerns of, or what is happening with the nurses in the state of New York? Like, what's the situation right now of the career of nursing and the jobs in nursing in the hospitals in New York?
Well, there's a high demand for nursing, especially you saw it with COVID. Nurses make they make good amount of money. Through our union, we've been able to make sure that they have a pension, that they have education credits if they want to get their master's or they want to specialize in an area. It was also a very hard time for nurses because they were in the midst of the pandemic taking care of patients that were sick with COVID. And a lot of them got sick with the disease, with the infection.
Okay, I have a question. The organization have the control of the hospital in New York, or is for part?
We represent nurses at all the major hospitals in New York City. So we are a union. So if you're gonna get a job as a nurse, a Presbyterian, you have to be a member of our union.
Okay, now I got it, because I was a little bit confused. It's not that you like you in the organization you like you can help a nurse to get job in the hospital.
Well, when we talk to them, they already have a job. But if there are people that need nursing jobs and they send us their resume, we can pass it along to whoever has a need.
Okay.
Anybody else has a question for the senator? Well, while you formulate your questions, guys, Marisol, you said that it's a very demanded profession, nursing, right now because of the pandemic and even before that. But how the nurse association have any, like, is there anything that is linked to the organization regarding for example, job opportunities for nurses or scholarships for nurses, or that's not something that is related to your association?
No, that's not something that's related to us. Most of the time, when they get a job in nursing, most of the hospitals pay for them to get master's degrees and so on. But I know, for example, that if you get a job at Montefiore or a Presbyterian or a Mount Sinai, even if you get a job in the clerical division, they would pay for you to go to like nursing school or whatever kind of school you want to go to.
Okay.
And right now there's a need for nurses that are bilingual in Spanish and English. Only 2% of nurses in the whole country are Latinas. So there's a huge percentage for people that are bilingual. And most nurses, they only work 12 hours a day, 3 days a week.
All right.
Okay.
Marisol, do you have a question, Desiree?
No.
All right. So, how this pandemic has affected the work of nurses in in the middle of this COVID-19 pandemic and all this turmoil?
Well, it was very hard because at first, some of them did not want to go home when they were working because they didn't want to infect their family members. So we worked to get them hotel rooms so they can go and stay in hotel rooms. And some of them got sick during the pandemic. And when they got sick, we told them to file for workers' compensation. Some of them were giving a lot of work. Normally, if you only take care of 6 patients during the pandemic, that kind of quadruple. And if you only work 3 days a week, you had to work 4 and 5 days a week because there was a lot of overtime, because there was a lot of people that couldn't come to work. So, and a lot of people were very upset because they saw a lot of people dying, a lot of young people that die, a lot of people that, that were healthy, they came into the hospital and they just died. So it's been very hard, very traumatizing.
So since pandemic, a lot of nurse is not living in their own house, just
No,
in an hotel.
no, that was at the beginning. They used to stay at
Oh,
a
okay.
hotel because remember, they didn't know much about it. So they were
Mm-hmm.
afraid of wearing the clothes home or infecting their children. And a lot of nurses got infected and some of them died.
Mm-hmm.
Yeah.
Wow. Mm-hmm.
Some of them have little small children. Some of them
Mm-hmm.
live at home with their parents. Some of them, they suffer from diabetes, high blood pressure. So they were afraid of uh,
Mm-hmm.
especially at Bellevue Hospital, uh, about 10 nurses died.
Oh,
10
wow.
nurses died during
Okay.
the COVID-19 pandemic.
At just one hospital, more died everywhere else. Yeah, a lot of people got sick.
Wow.
So when the nurses were infected, they have to work or they can stay in their house.
Well, believe it or not, at the beginning, they were making them work. When
Wow.
they took the test, yes, they were like, oh, I'm sorry, you got to come to work. And we fought very hard with the hospitals to make them stay in quarantine for 14 days and so they could pay them. But at first, they didn't want to. They were like, oh, you sick? Come to work.
Because,
That's
for
awful.
example,
Yes,
the option of working online is not something that you can think for nursing. You cannot do the job online. You have to be on the place. So the nurses were the type of professionals like, let's say, essential workers that should
yes,
be on the place, should take the biggest risk, working with patients that you already know and were diagnosed with the COVID-19 disease. So it's a very tough job.
yes. But it's
Mm-hmm.
very rewarding and it pays very well. So
How much it
it's
pays a year?
it depends. Like at Presbyterian, if you just right off college, you could start off with 96,000, 3 days a week.
96,000. That's a very good salary.
Yeah, and most people make more than that because you normally you do a little bit of overtime, and then every year, the more experience you get, the more raises you get, and the more they pay you. And it's an opportunity for you to go to school. It's a very rewarding job. If you think about it, when you go to the doctor, if you've ever been in a hospital, you probably only see the doctor once a week, and the person that you see the most is the nurse.
Mm-hmm.
That's true.
Yeah, the doctor probably doesn't even remember your name. They get confused you with somebody else. So, you know,
Yes.
Well, any other question, guys or girls? All my students are girls in this class.
they're women, not girls.
Well, Marisol, something that comes to my mind is this is a law and ethics class, and what is involved in like related to the nurse association and malpractice, medical malpractice, lawsuits,
Well,
and also ethics.
I think in terms of ethics, nurses have to, and a hospital has to report everything that, like if a nurse goes to work and he or she is drunk, ethically the hospital has to report that to the state. If you're doing drugs, they report that to the state. If they catch you like stealing medicine, ethically they have to report that to the state. So there's a lot of little things ethically. If you get suspended, sometimes depends for what it is. Ethically, the hospital has to report it to the state. If you have an accident with a patient, ethically, sometimes they report it to the state. And ethically, a nurse is supposed to take care of somebody regardless of their economic. There are times that, if the person might be of a different religion or of a different sexual orientation than you are, and ethically, you have to take care of that person. So, like if a nurse sees child abuse in a kid, ethically they're supposed to report that. and that is supposed to be reported to the state. So, people think, oh my God, if you have a little baby, right? I have a son. If my son goes to the doctor and he has a lot of bruises, ethically, the medical professional is supposed to report me. So sometimes it's not that people want to, it's that they can get in trouble ethically if they don't do it.
And also, all these regulations like OSHA or HIPAA applies to the nurses too.
Correctly. HIPAA is very important because the way HIPAA came about is that there was somebody in an elevator talking about a patient and the family was in the elevator. So to nurses, HIPAA is something very important. You never discuss a patient's business with anybody. You never talk about, some hospitals, they have sign in the elevator. They said, please keep it quiet. They might be family members. So there's a lot of, things that you are supposed to, like, for example, if a nurse gets into a car accident, ethically, and you kill somebody like a regular person, your job doesn't have to know. But ethically, they report that to the nurse is supposed to report that and they put it in your license. If you get caught drinking and driving, ethically, the state is going to know about it and find out. So HIPAA is very important because you cannot, there's a lot of things about patients. It might be somebody from your neighborhood and you're not supposed to talk about what goes on in that person's, because they can sue the hospital and they could sue you.
They can go to prison for one of this, for one of that you said.
Like, what do you mean?
Like if they do something malpractice or they can go to prison.
It depends, if you are on drugs. I mean, yeah, but if you're not, if it's just an accident, they report it on your license. And most nurses, they have private insurance.
Okay.
But, also a lot of nurses, they get hurt on the job. Imagine if you have a patient that is like 500 pounds and you're supposed to lift it, there goes your back. Or sometimes patients, they say mean things to the nurses, they curse at you, they want to throw things at you, they want to spit on you. So, it could be a very difficult job.
Okay.
Marisol, when you think about a nurse union, I don't know if you can say it's the same as a nurse association, but when you think about a nurse union or any union, you think about a protest, protesting for some rights, like demanding for things. Uh,
Well, you demand, if there's contract negotiations, if the nurses have too many patients, you have a rally outside. And sometimes you do, and it doesn't have nothing to do with your job. It has to do with the community. So, for example, at Montefiore Hospital in the Bronx, we were protesting because there were a lot of patients in the hallway. And we felt that they were not taking care of poor people the way people should be treated. No patient should be on the hallway. For example, Presbyterian has a floor that they call it VIP, very important people. And in there, you get a private room with a private shower. You get a chef's cook your meal. So we were protesting. We were saying every patient should be a VIP. So that's the kind of protest that we do. It's about patient care, to making sure, because now in the United States, everything is becoming a business. So you go to a hospital. Before, if you had a baby, you could stay in a hospital for 5 days. Now, after 2 days, they want to get you out. They don't care if you're in pain, if the baby's sick, they want to send you home. So we believe that healthcare should be a human right and it's not a business. So.
Marisol, we just have like 7 more minutes, but there is something that we cannot skip today, and is what were the biggest challenges you faced in the Nurse Association during the COVID-19 pandemic? Like
They were, well, they were forcing people to come to work, even though people were sick. They did not want to pay them for staying at home. They told them to use their sick days or their vacation time. And we felt that you got sick on the job, that you should not use your sick time, that they should pay you for that. We also, one of the challenges is that we felt that people should have been given bonuses, because there were people that were working without taking a break, without taking lunch hour. Now imagine 12 hours a day, you standing up on your feet is very hard. So those things were very challenging. And also emotionally, that people were seeing so many people dying, so many young people coming into the hospitals and dying. And last but not least, there was a time that the commissioner of the New York State Department of Health gave out an order saying that if the person was too sick, to kind of just let them die and move on to the next person. So to a lot of our members, that was something very hard to deal with.
Anybody has any other questions for the senator?
No.
Well, thank you, everybody. If you have any questions, you can send them to Eric, and I'd be more than happy to reply. Thank you for having me. I know that it's very hard for you guys to get used to this online, this new way of doing business, but thank you for having me, and good luck in your school year.
Yeah.
Thank you. Thank you for being here and all the information.
Thank you. Bye-bye.
Before you leave, Marisol, let me show to the students the website of the Nurse Association. Just for the, are you able to see the website?
Yes, I am.
This is the one, Marisol, right? This is the correct one.
Yes, correct. Yes.
The New York State Nurses Association, NYSNA.org. That's the website. Okay, guys. Thank you, Marisol, so much. And
thank you. Take care, guys.
it was great to have you.
Thank you.
After
Thank you,
the
guys.
International Women's Day. Happy International.
Thank you, and good luck, everybody. Thank you. Take care, everybody. Bye-bye.
Have a good
Thank you. Bye-bye.
Bye.
Well, thank you, guys or girls. She said you are women, right? Or ladies.
Yes.
Well, thank you so much for participating in the class of today. I hope that you enjoy something different, a different voice, and a different perspective. Because my perspective is from the standpoint of a medical doctor from Dominican Republic that has a few years living in New York. But Marisol Alcantara is a senator from New York State that have several years working in the Nurse Association, and it's a great contact. It's a great thing to have her in our contacts. If you need anything, or if you wanna reach the senator for finding out more about the Nurse Association, I can give you access to it. So this is gonna be the class for today. We have 3 more minutes of the Zoom meeting, but I think that for today is gonna be all. I have another class at 6 p.m. But thank you for being in the class. I'm going to organize well what's for week 5 in the Blackboard. I have to edit it and put what's the chapter, the specific chapter for it, and post a discussion board in week 4 and a quiz in week 5. So give me time to do that. And thank you so much. Have a good night.
Okay, good night. Bye.
See you.
Thank you, Professor. Bye. Have a good night.